Good afternoon and welcome to this episode of Bright Blue TV. I'm Phoebe Arslanagic-Wakefield, Senior Researcher at Bright Blue. Last year, Prime Minister Boris Johnson said that Brits should lose weight to fight coronavirus and launched a new obesity strategy. And the National Food Strategy has this year made proposals including taxes on sugar and salt. However, despite government intervention beginning in the 90s, the majority of UK adults are still overweight, 67% of men and 60% of women in 2020. Is any of the government's business what we eat? And is our national discourse about obesity actually contributing to many people's poor relationship with food? And to answer these questions, we're joined by two fantastic guests, Chris Snowdon, Head of Lifestyle Economics at the IEA, and Dolly Tice, final year PhD student at the MRC Epidemiology Unit at the University of Cambridge and the co-founder of the 50/50 Parliament. So, just quickly before we get the discussion started, if you are tweeting about or during the event, then please do use the hashtag BBTV. And if you'd like to put your own questions to the speakers, then you can do so via Slido using the link in the description of this video. I would be really delighted to receive those. So Dolly, there's been lots of discussion about obesity as a dangerous underlying condition in the context of COVID. Do you think that this realization marks a sea change in how the government, but also ordinary Brits, view the issue of obesity?
No, in terms of would it be a sea change, because we've seen many ebbs and flows of government interest in this whole agenda over the last 30 years. And as you said, the UK government first formally recognised its sort of role in tackling this issue in the early 90s, although the issue had been discussed for sort of many decades before that. But I think what this has shown in terms of the pandemic related to this whole issue is just how vulnerable a poor diet or poor state of health can make people when something like this comes along. And I drew parallels over the pandemic to the Boer War to show that that was another time where a crisis like a war, or the Second World War even, as well as another example, can also indicate how vulnerable the population was. And I use the Boer War because they failed to recruit enough healthy people to fight in that. And so there were some early food policies and weighing, measuring in schools as a result of that, because they realized how important having a kind of fighting fit population was when it came to a war. So whether it's a pandemic, war or whatever, crises obviously are massive sort of focusing events, if we can call them that, for governments. But I don't know, I mean, this is hypothetical. I don't know if the Prime Minister Boris Johnson would have produced another strategy had he himself not been so personally affected by it and had this sort of wake-up call moment where he talks about recognizing that his own weight played a massive role in how he fared so badly when he caught COVID. So it's very difficult to gauge whether the pandemic in and of itself or whether it was his personal experience that really spurred him to produce the 14th government obesity strategy that we've seen over the last 30 years.
Chris, do you think the public are going to tolerate Boris Johnson's increasing interest in how much they weigh?
Up to a point. The stuff that really primarily affects business, I guess, won't really bother most people. Restrictions on advertising don't tend to bother most people. People don't really like advertising at all. They don't really appreciate what it does. So, not massively at the moment. But I mean, they're going to have to keep doing more and more of this because none of it's going to work. And at some point, people will snap. There was a bit of a backlash against the idea of banning effectively every food company, really, large and small, bakeries, wedding cake shops, and all the rest of it from advertising anywhere online ever. So the government's had to water some of that stuff down. But yeah, it's not unpopular at the moment. But hopefully a time will come when it is unpopular. I mean, the government is going to keep having to throw more and more things at this because it's not going to work. The government can't control how much people weigh. The government can't hardly do anything. It can't provide decent healthcare. The public health establishment is totally useless, as has been shown during the course of the pandemic. Public Health England's finally even been closed down because it became unavoidable how incompetent they were. And they were scratching around for something that they were familiar with to try and pin on the pandemic. And so was Boris Johnson. I think the fact that he did have this near-death experience probably did have an effect on Boris Johnson. I haven't noticed him losing a lot of weight since then, I have to say. But yeah, the public health lobby for years have been ignoring infectious disease and focusing on whether people are, eating the greens or not, or how much alcohol they consume. And when the pandemic came along, they were desperate to find a familiar framework in which to, by which to look at it. And they couldn't pin it on smoking because smokers are less likely to get COVID. They couldn't pin it on alcohol because alcohol is completely irrelevant to it. So they were delighted to find this relationship between COVID mortality and obesity. And they just pulled off a whole lot of useless policies that have been lying on the shelf for several years. And Boris said, here we go, we're doing something about this. And in effect, the implicit message was, we've got a high death rate because people in this country are too fat. It's not true, actually. If you do the calculations and look at how many people would have died if we'd had significantly lower rates of obesity, like Italy, for example, it makes very little difference. The reason lots of people have died from COVID is lots of people have been infected with it.
Chris has raised the issues of effectiveness of useless policies, Dolly. I mean, your PhD research analysed all government obesity policies published in England between 1992 and 2020, almost 700 individual policies, I believe. You found that they were rarely implemented, that the same types of policies come up again and again. Does your work show that this just isn't really a space that government can meaningfully intervene?
Yeah, it's a really interesting question. And I think there were a few things that Chris talked about which are important to kind of define and make clear. So there's sort of two things that I found very, very interesting about analysing all of them is, firstly, we call obesity policies sort of anything related to sort of diet, physical activity, and it can even go beyond that. And so really, when I did this analysis, I started to indicate that when we talk about sort of obesity policies, we should be more specific when we're talking about policies that seek to help support people living with obesity specifically. So anything like weight management services, bariatric surgery, that sort of thing. In terms of wider public health policies, that really falls into the remit of just trying to make it easier for everyone to enjoy a healthy diet, be physically active without it being, fighting against the tide of the environment that you are in, socioeconomic conditions, et cetera, et cetera. So there's one distinction which is really important in this, is that I would love the day where we're not talking about obesity policies and we're talking about all of those. We're just talking about policies related to making it easier to live a healthy life. And the second thing is exactly what you talk about in terms of the recycled policies and lack of implementation, is largely related to the fact that a lot of debate around policy, and it doesn't really matter what the issue is focused on the what. So we constantly sort of go, what idea is better? What should we do? And not enough emphasis is placed on the how, because you can have all the best ideas in the world, but if really the reality is they're not implemented, or there's little policy progression after a government actually publishes a strategy, then it doesn't matter how good the policy idea is. You don't have it saying, we aren't even able to build up the evidence base on how it works in practice if they're not followed through. So I try to use this analysis to not only talk about the what, which includes, are these obesity policies, or actually are these policies for everyone, just making it easier for everyone to live a healthier life? And then also how are they going to be implemented? Do they make that easy? Do they facilitate that when they propose it? I'm saying they, being government officials, do they make that easy by presenting policies in a way with all the information needed to implement that? And sadly, very few did. In fact, just as an example, the largest proportion of policies weren't proposed with any information that enabled the implementation of them, versus just 8% that were proposed with all the information that would facilitate implementation.
Dolly's spoken about policies that make it easier to lead a healthy life. Research from Demos last year found that 71% of the public would support government subsidies and make healthy food cheaper. But Chris, would that actually be an effective policy? I mean, the price of healthy foods, such as vegetables and pulses, it's already quite low, isn't it?
Yeah, it's very low. It's one of the many myths in public health that it's expensive or inconvenient to eat a healthy diet. It's inconvenient up to a point, because it's quite difficult to make tasty food out of vegetables, because vegetables aren't very nice, but they're very, very cheap, which is why they've been the staple food of the poor throughout history. What does it even mean, subsidizing healthy food? How do you even go about doing that? I mean, the government doesn't control the price of food. I can't even imagine what kind of system you would have in place in order to make turnips even cheaper than they are now. You're going to subsidize farmers more, you subsidize supermarkets more. How do you decide what the original price is? It's wide open to fraud, apart from anything else. It's just another of these stupid 2 o'clock in the morning ideas that people in public health throw around. Wouldn't it be nice? Let's make let's make unhealthy food more expensive, or make healthy food less expensive. They haven't got a proper definition of either. None of it's based on any evidence. We have had policies introduced, in fact, over the years, as you've already alluded to. None of them have made any difference. We've got loads of evidence on all the things the government's doing. We've got evidence, dozens and dozens of studies looking at whether people who live near fast food shops, for example, are more obese. They're not. The government just ignores that, and councils go around closing down or forbidding new food outlets from opening up. We've got over a decade of evidence on sugar taxes. They don't have any effect whatsoever. They barely have an effect on people's consumption of sugary drinks, let alone the consumption of sugar or calories. We've got a randomized control, at least one randomized control trial I know of, looking at food reformulation. Shows it doesn't make any difference whatsoever to what people consume. And yet the government carries on doing them anyway. There's no evidence and advertising. It's all just a waste of time. And most of the people who work in public health should be sacked, and the money should be used for hospital beds and doctors.
Dolly, I mean, do you agree that subsidizing healthy food is a stupid 2 o'clock in the morning policy idea?
No, and I laugh, and I must say that I put my thumb down at Chris saying that vegetables are disgusting. I put my thumb down for the point. not in agreement that vegetables are disgusting. I mean, a lot of Chris's argument is based on the assumption that one policy will lead to big outcomes. And that's just not how public health interventions work, as we all know. So you can't just look at something like the soft drinks industry levy and try and draw parallels with whether that alone will indicate a kind of, or result in a reduction in obesity. It's just such a complex field in that way. And when it comes to the kind of vegetables are cheaper argument, which has been used a lot, that is built on the assumption that a choice is just based on cost. And we know that people's choices are not just based on cost. They're based on convenience. They're based on social norms. They're based on how much marketing
taste,
and advertising.
flavor.
I mean, literally everything. So the idea that you can just say that people aren't, that you've got cheap, raw food options available, and then suddenly everyone's going to start cooking is just not realistic. So it's really important to base policies on how human beings behave in reality, what's feasible, and to try things out and monitor them as they go. And Chris is right, there needs to be multiple interventions. That's how this whole thing works. It's also how it worked in terms of tackling more simple public health problems like tobacco smoking, where you've got one product. It wasn't one policy that achieved a reduction in smoking rates. It was multiple policies. So I think that's really key. And it's said time and time again that there's no silver bullet, but there isn't.
Chris, are you concerned that policies that the government's put forward, such as restrictions on food advertising or forcing restaurants to put calorie counts on menus, do you think that they're effective? And are they actually just, more importantly, perhaps too burdensome on businesses?
Well, the advertising thing is a massive burden, and it's really bad for everybody involved. It's really hard to bring a new food product to market. The vast majority of them fail within weeks or months. And the government's effectively preventing companies from ever advertising these products online at all, and very heavily restricting what they can do on television and other media. So yeah, that's a big problem. And people will think, oh, well, it's only junk food. It's not junk food. It includes all sorts of stuff that most people consider to be totally normal, whether it's like normal kind of treats like, ice cream or something, or something like jam, or even something like cheese and sausages and pies and all the rest of it. So it's a massive burden on them. The calorie count thing is interesting because I'm not, on principle, I'm not against it, because it's all a matter of giving people information. But it's another example where we've got a big evidence base showing what happens, because we're not the first country to try this, what happens when you do it, and it doesn't make any difference. So, it's just public health pretends to be evidence-based, and yet not only is it not evidence, it's kind of actually not just unscientific, it's anti-scientific. It looks at the literature, which shows that this stuff isn't going to make any difference, and it goes ahead with the policy anyway. And then it comes out with this spiel that you just heard from Dolly, which, one thing won't make a difference. Well, actually, effective public health interventions do make a difference. You can see a visible difference when a population is vaccinated, for example. I don't expect to see obesity, halve as a result of the sugar tax or a restriction on advertising or Jamie Oliver's bloody school dinners. I would expect to see some sort of effect. Let's settle for 0.5% drop in obesity as a result of the combination of those measures. Has that even happened? No. I would expect to see a reduction in calorie consumption, even a small one, as a result of the sugar tax. Hasn't happened anywhere. but it doesn't matter. The bandwagon continues regardless.
Dolly, we have a question from the audience here for you. So thank you to Daniel for sending in your question, who asks, is there a way to effectively tackle obesity without it being so coercive and interventionist on the part of government?
I mean, I don't want to throw back loads of questions in relation to that question, but what counts as coercive? And because the menu labeling point that Chris says is a really interesting one. So the menu labeling debate is one of these things that people that sort of identify as libertarian or whatever would not have so much of a problem with it, seeing as it falls within the kind of giving people information, and that could be indicated as less coercive because you're not sort of getting restaurants to change their food or whatever, you're just giving people information. And Chris is actually right. The evidence on whether that changes people's choices that they make is mixed to weak. But the potential of it to incentivize restaurants to serve healthier foods or better foods or diversify their portfolio is more interesting. And that evidence is starting to be built. So kind of throwing out the idea that something is rubbish based on one interpretation of how it works in practice is not necessarily the best way to go forward. You'd be shutting down all sorts of understandings about the kind of how these things work in practice. But it depends what you mean by coercive. Should we make it just easier for people to live healthier lives and enjoy a healthy diet? I would say yes. It's kind of crazy that we live in a world where the cards are stacked against most people, and it is very, very difficult because what is advertised and made available and made most convenient and what we see as our norms wherever we go in the UK is disproportionately balanced or tilted towards the unhealthy options. So it's not about taking away choice. It's literally about rebalancing it so that when you go to a supermarket, and unfortunately, it is more expensive on healthy foods when you take into consideration convenience and appealingness, because you can have a rotting rubbish apple, which I see in crappy sort of train stations. And of course, that's not a choice if it's there. It needs to be all of the other things to be a fair choice. It needs to be convenient, affordable, appealing, etc., etc. And until we have a world that makes the healthier options delicious, appealing, affordable, convenient, more so than the unhealthy options, we're unlikely to see that change.
Chris, does the government focus and sort of concentration of resources on obesity come at the cost of considering other health and well-being interventions that could be made, perhaps that, in your view, are more evidence-based?
Well, to the extent that the money wasted on organisations like Public Health England could go to frontline healthcare, yeah. I mean, the vanity of people in public health and the government thinking they can do anything about the nation's waistline when people know perfectly well that if they eat lots of cream cakes, they'll get fat. In fact, the interesting thing I think about the whole labeling, the evidence on labeling calorie counts is the fact that people don't change their behavior is a pretty good indication that they know exactly, or roughly at least, how many calories are in an apple pie and are not eating it because they think it's healthy. They're eating it because it's really quite tasty in a way that a baked potato perhaps isn't, or to most people, maybe not to Dolly. So yeah, it's a waste of money, obviously, because none of it works, and you've got lots of people on big salaries talking about this, and will continue for years and years to come until some government finally works out that it can't do anything about this issue. It's entirely focused on food. It largely ignores physical activity because it can't legislate for physical activity. So as I said before, this racket should be closed down and the money should go to hospitals.
Dolly, increasing numbers of people, especially young people, are concerned how national discourse on obesity is contributing to disordered relationships with food. Is that something that concerns you?
Massively, massively, massively. And that's why I said at the beginning that I would love at some point that we don't frame even events like this as obesity, talking about obesity policy, because that distinction is so important. And the emphasis on weight tends to be incredibly unhelpful, incredibly stigmatizing. And really, this is about two things. This is about creating a world where it's easy for anyone, regardless of their circumstance, to enjoy a healthy diet and I really mean enjoy that. It shouldn't be that it's this perception of a boring life, and be physically active in a way that's not arduous or, people having to go out their way. And the other side is that for those people living with obesity that need support, if they want it, those services need to be available. And that's partly why we don't see this, the outcomes that Chris is indicating, because policies around weight management services, for example, are not mandated. And so depending on where you live, you may not actually have weight management services even available in your area. So when we're talking about that distinction, I would love it to move away from weight generally and just talk about it being policies that try and make it easy for anyone to enjoy a healthier life. And when it comes to obesity policies, i.e. those related to supporting people living with obesity, we really need to ensure that those services are available and effective and non-stigmatizing.
Chris, Dolly is concerned about stigma. Do you think that these government obesity policies could actually be doing active harm in this sense?
Yeah, and people in public health are very keen to say that they are not stigmatizing people living with obesity, as Dolly calls them. But it's inevitable. You know, if you're going to effectively start treating this issue like smoking, which is exactly what they're doing, they're just borrowing a whole load of anti-smoking policies, really, and trying to apply them totally inappropriately to the food supply, then you'll end up with obese people being treated like smokers, which is to say, in this country at least, like second-class citizens. And although it might not be the intention of people in public health for that to happen, and for fat people to be denormalized, it's exactly what's going to happen. You're bound to create resentment towards obese people, particularly if you keep claiming that they're going to bankrupt the NHS, or that they're the large part of the reason why we've had so many COVID deaths and they're clogging up the hospital beds, none of which is really true. And if you say that they're costing billions and billions of pounds, which are not. So it's inevitable, I think, as part of this kind of basically denormalization campaign, that people would be quite unfairly stigmatized. There's also the knock-on effect with people with eating disorders. You know, I find common cause on particularly the calorie labeling scheme, but also the reformulation scheme with the community of people who have suffered from eating disorders. They're really concerned about it. They don't want this obsession with calories. But again, it's an inevitable part of this crusade.
Oh, we have another question through here from Henry. Thank you for your question, Henry. I'll give this one to Dolly. Is there any country which has actually been successful in reducing obesity significantly, and what is it that they did?
Yeah, so this is always a massive a kind of focus for people looking at this issue. And I did a massive case study in 2016-17 time when I was at the Centre for Social Justice think tank on the Amsterdam Healthy Weight Programme, because they had been able to see some reductions in the childhood obesity rates there. And they took what is called a kind of whole systems approach, the idea that, again, coming back down to what we were saying earlier, that you can't sort of just focus on one particular area, you need to do it across. And this is about social norms and culture. You need to just make it easy for people, and it's normal for people to enjoy a healthy diet, not going out of your way or having to seek, the healthy option against the bombardment of unhealthy options that we live in. So that was introduced by the former Liberal deputy mayor in Amsterdam, and is still going. And they also take a learning by doing approach, the idea being that you can't always know how policies are going to work in practice, especially at the population level. So you sort of need to encourage policymakers to experiment and innovate, and, not in a kind of scary, dangerous way, but to really monitor effectively, so that if there are negative unintended consequences, you can actually stop and change course quickly. So I would urge people to look at Amsterdam Healthy Weight Programme. There are policies, unfortunately, often in the countries that have very serious situations, which is probably unsurprising. So Mexico, Chile, South Africa, lots of public health policies in this space being introduced and monitored. And again, this is such a political issue that the reality of achieving change, we also need to celebrate where there is progress. And I really believe strongly in that we shouldn't just condemn governments always as not doing enough, because this is very politically charged, it's very complex, and we should be facilitating as much learning and as much meaningful policy progress as we possibly can.
Yeah, Amsterdam's the only one I can think of that's done it deliberately. Obviously, it's not a country. It was extremely labor and resource intensive. It didn't involve banning advertising or anything like that. It involved really serious hands-on work, working with families over an intense period of time, which is why it's never going to happen in this country, because it's too expensive and involves people in public health getting their hands dirty, having to meet normal people. Some countries have succeeded in the past with this. Cuba was a great success story after the fall of the Soviet Union. They ran out of money, ran out of petrol, so people had to walk a lot more. There's actually been a study genuinely saying this is a kind of success story. There's maybe something to learn from this. Venezuela's done quite well on obesity. North Korea was applauded by the head of the WHO show a few years ago for having low rates of obesity. There is a serious point to this, which is that affluent countries are going to have a lot of obesity, and it's probably not going to come down. And the only way you can reduce obesity is by making people very poor. It's an intractable problem, I would say, in affluent countries. As long as people have a bit of money and a bit of choice, they're going to continue to some extent stuff in the faces, and actually most people are quite happy with that. The idea that everybody who's overweight wants the government to intervene on their behalf is complete nonsense.
Well, on that, Chris, we've just got time for one final audience question. This is from Sam. Thank you for sending your question, Sam, who asks you, Chris, is it not better to take a proactive, preventative approach on obesity and other health problems rather than just react to whatever poor health outcomes emerge down the line?
Well, it would be if there was a way of doing it. I mean, one of my main arguments today has been that the people in public health, there's a genuine controversy about what causes obesity in the first place. No one really understands why rates of obesity have gone up so much over time. In actual fact, body mass index, body weight on average has been increasing fairly steadily since the 1880s. This is not a modern phenomenon, and it pretty much goes up in line with economic growth. And once everybody's got enough money to be able to eat, then the people who are genetically disposed to obesity, and it's a highly heritable condition, are going to get obese. So yeah, it would be nice to prevent it if there was an easy way of doing it, but there isn't. And show me the plan. Show me some evidence that any of this stuff is going to work. Show me evidence from places like Chile. Has that worked? I was taking Tony the Tiger off Frosty's had any effect in Chile? Let's have a look at it. Let's have a look at the evidence. Let's have a look at the costs and benefits, and we can decide as a society whether it's worthwhile doing. But I've never seen a single policy that has even a small effect on this issue. So it's all cost and no benefit, as far as I can tell.
And that is where we have to leave it. Many thanks to Dolly and Chris for their time and thoughts. Also to our audience for joining us today and sending in their excellent questions. See you next time and have a lovely weekend.
Thank you.